CNA Practice Test Questions and Answers 2026 Sheet 1. Question 1. How can you assist a resident who has difficulty standing in the shower? Have them sit on a shower stool. Hold them upright during the entire shower. Use a handheld shower head to avoid standing. Give them a sponge bath instead. A shower stool provides stability and reduces the risk of falls, making the shower process safer and more comfortable for the resident. Question 2. A patient with a nasogastric NG tube should be positioned in which of the following ways to prevent aspiration? Flat on their back. Fowler's position. Supine position. Trendelenburg position. The Fowler's position helps prevent aspiration by keeping the head elevated, reducing the risk of gastric contents coming back up and entering the airway. Question 3. What is the most important reason for using proper body mechanics when moving patients? To avoid injury to the patient. To reduce time and effort. To comply with facility regulations. To prevent muscle strain and injury to the healthcare worker. Proper body mechanics are essential for preventing muscle strain and injury to the caregiver, especially during patient handling. Question 4. When measuring a patient's blood pressure, which of the following actions should be avoided to ensure an accurate reading? Positioning the arm at heart level. Using a cuff that fits properly. Having a patient sit quietly for 5 minutes before the measurement. Taking the measurement over clothing. Taking blood pressure over clothing can lead to inaccurate readings as it interferes with the cuff's ability to measure the pressure accurately. Question 5. Which of the following is a sign of hypoglycemia in a diabetic patient? Diaphoresis, excessive sweating. Bradycardia, slow heart rate. Hyperactivity. Polyuria, excessive urination. Diaphoresis is a common symptom of hypoglycemia, along with shakiness and confusion. Question 6. When helping a resident with limited hand strength to brush their hair, what is an effective tool to use? A regular hairbrush. A wide tooth comb with a built-up handle. An electric hairbrush. A small travel-size comb. A wide tooth comb with a built-up handle allows for better grip and is easier for residents with limited hand strength to use. Question 7. A patient complains of being lightheaded. What should the CNA's first action be? Administer nitroglycerin. Reassure the patient and stay with them. Call for help immediately. Take the resident's or patient's vital signs. The priority is to ensure the patient receives prompt medical attention for a potentially life-threatening condition. Question 8. Which of the following is the primary purpose of using antiembolism stockings? To provide warmth. To support weak muscles. To reduce swelling in the legs. To promote venous return and prevent blood clots. These stockings help circulate blood back to the heart, preventing blood clots and reducing swelling in the legs. Question 9. When assisting a resident with ambulation after surgery, which of the following is the most important safety measure? Providing a patient with pain medication beforehand. Ensuring the patient wears socks. Using a gait belt for support. Encouraging the patient to move quickly to build strength. Using a gait belt provides a secure way to hold onto the patient, preventing falls and ensuring safe movement. Question 10. Which of the following tasks is appropriate for a nursing assistant to perform when caring for a patient with a urinary catheter? Inserting the catheter. Measuring and recording urine output. Irrigating the catheter. Removing the catheter. A CNA can assist with measuring and recording the urine output but cannot perform invasive tasks like inserting or removing the catheter. Question 11. A nursing assistant finds a patient lying on the floor. What should be the first action? Assess the patient for breathing and pulse. Help the patient back to bed. Call the resident. Report the incident to the nurse or E.A.D. First, assess for signs of injury, breathing, pulse. Then report the incident to the nurse for proper intervention. Question 12. Which of the following foods is the best source of dietary fiber? Chicken breast. White rice. An apple with skin. Ice cream. Fruit, especially with skin, is rich in fiber, which promotes digestive health. Question 13. Which of the following symptoms might indicate that a patient is experiencing a urinary tract infection, UTI? High fever. Hematuria, blood in the urine. Constipation. Decreased thirst. Hematuria, blood in the urine, is a common sign of a UTI, along with painful urination and increased frequency. Question 14. A patient with Alzheimer's disease is becoming increasingly agitated. Which intervention should the nursing assistant implement first? Restrain the patient. Administer medication. Leave the patient alone. Use a calm and reassuring approach. A calm, reassuring approach helps to de-escalate agitation and avoid the need for restraints or medication. Question 15. A patient has an order for NPO status. Which of the following actions should the nursing assistant take? Remove the water pitcher from the room. Provide the patient with clear fluids only. Offer ice chips every hour. Encourage the patient to eat small, frequent meals. NPO means nothing by mouth, so the water pitcher should be removed to prevent the patient from accidentally drinking. Question 16. When performing perineal care for a female patient, the nursing assistant should wipe in which direction? Front to back. Back to front. Side to side. In a circular motion. Wiping from front to back helps prevent the spread of bacteria from the rectum to the urethra, reducing the risk of urinary tract infections. Question 17. The nursing assistant is helping a patient with passive range of motion. Which of the following is a key principle to follow? Perform exercises quickly to avoid fatigue. Force each joint to its maximum range. Support the joint being exercised. Perform exercises only once a day. Supporting the joint helps prevent injury and ensures the exercises are performed safely and efficiently. Question 18. What is the purpose of a bowel training program for a patient with chronic constipation? To promote the use of laxatives. To establish a regular bowel movement routine. To increase the frequency of bowel movements. To enhance dietary fiber intake. Bowel training helps establish a consistent routine and promotes healthy bowel habits, preventing constipation. Question 19. A patient with difficulty swallowing is at risk for aspiration. What should the nursing assistant do to minimize this risk during feeding? Offer large bites of food. Position the patient lying down. Provide thin liquids. Encourage the patient to take small bites and chew thoroughly. Small bites and thorough chewing reduce the risk of aspiration by ensuring the food is well prepared for swallowing. Question 20. Which of the following is the best method for a nursing assistant to use when communicating with a patient who has hearing loss? Speak loudly and quickly. Use a communication board. Write down instructions. Speak in a high-pitched voice. A communication board allows patients with hearing loss to understand messages clearly. Writing down instructions is also helpful.